I definitely feel, telemedicine can bring in equity for people who are physically distanced or let's say who are monetarily distanced. I look at equity in two forms. So, um, let's say equity for those people who are living in an unaccessible, let's say, region, either due to geography or either due to monetary, let's say, availability with them. And telemedicine can be the great platform where people can have healthcare access at a lesser cost because they don't have to pay the burden of poverty premium because they have to travel to a city, they have to pay for the transport, they have to pay for the day's work or the labor lost for a day. So I definitely feel, telemedicine can bring in equity for people who are physically distanced or let's say who are monetarily distanced. That is part one. Second is, I think, just bringing it on the payer side. So payers have a vested interest to use telemedicine because telemedicine can be very effectively used in the preventive care. So let's say Geeta does breast cancer screening, and it's a preventive mode. So if as a payer, my patients are all screened for breast cancer or let's say any form of cancer or any form of chronic diseases at a very early stage, I can catch them, I can control them with a less amount of money. If they are caught at a late stage, as a payer, I have to pay a lot of money. So, at the early stage, around 10 years back, we worked with ICICI to look for a risk-based premium. So what the payers are looking for is if I can know the risk of the individual, I can actually incentivize him for the good practices. So let's say he has gone through the preventive test, he has maintained a good balanced lifestyle, he is not smoking, he is not alcoholic, he is having a good night's sleep, then maybe I can charge him less premium because he is less likely to get sick. So this is seen to be in healthcare economics a better driving force where payer comes, they find a vested interest to keep people healthy so that they are actually ending up paying a lot more, difficult, let's say, bills, in future. Coming to equity for a country like us, which is India, where Ayushman Bharat is now started as the largest public payer kind of a system. But if Ayushman Bharat has to come into effect, the challenges what the normal hospitals are facing now, the rates or the bills or the tariffs are not sustainable for big hospitals or also let's say mid-sized hospitals. The tariffs are actually very, very low. So how do you involve the private capacity like the tier 2 or tier 3 or tier 4 hospitals who can actually be the provider for Ayushman Bharat yet to be profitable? And again, their telemedicine is the only way. So they can participate through telemedicine where the cost per patient is going to be very, very less for doctors or the providers. And that is the only way how Ayushman Bharat can sustain in the long run. So people can go for all kind of screenings, all kind of preventive tests, all kind of follow-ups without spending much, as well as without burdening the payer in the long run. So I would feel as the payer and the provider come together through technology for having a good motive of providing the best preventive care for patients. This will provide the ultimate equity to all of those people, who are currently being left out from the tertiary, glazy, and glittering, big hospitals, which has done great work on tertiary care, but unfortunately not done very good work on the primary and the secondary care.